Hi guys. So today I was thinking that I would talk a little bit about testing your blood sugar. For me, super important because I um, have a history of diabetes. However, it is a great tool to use even if you don't have diabetes, or maybe you don't know you have diabetes, or you're pre-diabetic. Um, what I use is this. I've used different monitors in the past, but this is the Contour Next EZ. You don't have to have a prescription to get any of this. You can go on Amazon, and I'll put the links down below. This one's fine. I've used different brands before, and the only reason I got this one in the last few months was because the last one I had, they no longer made the strips. So I ended up just buying this one. You can find it at Walmart too, but it's more expensive. It's I don't know if the monitor's more expensive, but the strips are. I got twice as many strips for probably half the cost on Amazon. So these are the strips that come separately, but they go with it. Um, so I was just going to show you how I test my sugar. It's super easy, and I know that some of you are like, I don't want to stick myself, but literally, like, there's worse pains in the world. A paper cut hurts worse than this. It's just super quick. Um, this particular, this one came with my other monitor, and I like it. I don't know. I just use it because it's the one I've had. But it has different settings on it. So if you pull this off, this is the little teeny tiny needle that you use, and it has different settings on it. Like if you don't care about pain, or your fingers are really tough, you might turn it way up. But I keep it on 1 because I'm a little bit of a baby. So basically, all I do is, I don't always use alcohol, but typically I take my sugar first thing in the morning. And so after I go to the bathroom, wash my hands really good, I'll do that. But if it's just like during the day and I just want to check like a 2 hour after I've had a meal that I'm kind of curious, about how it's affecting my blood sugar, um, I will I will go ahead and use alcohol to clean my hands off, or I'll just wash it real good. So I'm basically taking the strip out, and there's like a little, I don't know if you can see that at the top, a little computer chip, I guess, and this is where you stick this in. Super easy. All right. So then the finger that I want to check, and you can check any of your fingers, and I think you can actually do it on different parts of your body, but I just always do my fingers. Um, so, I mean, literally, like barely even anything, and I was able to squeeze out blood. Hope you're not squirmish. And I just squeeze out a little bit. You don't need a ton. And then you just put it on put it on the um, strip and let it kind of siphon it. And this says 102, so which is fine. Fasting, you want it to be below 100. But I had breakfast just a little bit ago, and I actually just ate some bacon right before I came out here. So one of the things that I'll eventually talk a little bit more about is how every time we eat, our body produces insulin. So, and then I just pulled out. So when we eat, our body is constantly wanting to make sure that our blood glucose is going where it needs to go, and insulin's all leveled out. So every time you eat, it doesn't even matter if you eat really low carb or high carb, you're always going to be producing that insulin, and so your blood sugar will go up and down as your body's trying to sort all that out. So I think it's 140 that it's supposed to be below, maybe 120, after 2 hours after you eat. But I literally just had bacon in my mouth, so I'm sure that's why it went up to 100. I just checked it a minute ago. It was like 84, and that was pretty much, I guess, 2 hours or so after I ate. So if you're checking your sugar, the best time to do it is first thing in the morning at your fasting, and then you can choose a meal and do 2 hours after, and you can kind of alternate which ones you want to do. You can do like 2 hours after breakfast, you can do 2 hours after lunch, 2 hours after dinner. I tend to have higher sugars when I'm not eating a low carb diet in the morning and right after breakfast. Those cereal type meals would shoot my sugar way up, maybe 180, 190. So I knew that my body was not appreciating the carbs very much. So, but the way I eat now, my sugar's rarely up more than maybe 110 after a meal, and a lot of times it's not even that. A lot of times it's maybe 80, 84, 85. So that is helpful for me to know what's going on. While we can't test our insulin every day just because of the expense of it, we can check our blood sugar. And so that is super helpful in knowing what's going on in your body. So I highly recommend getting this as a tool. I want to say the strips were about $20. I can't remember, but it came with like 100, so that would last you quite a while if you're just checking once. And you wouldn't even have to check it every day. I check it every day just because of my history of diabetes, but you wouldn't have to check it every day. Just every now and then, just to see how your body is reacting to food. So doing a fasting before you eat or drink anything first thing in the morning, and then maybe do another one 2 hours after maybe a really big meal, or just to kind of see where you're at right now before you even start on keto, but just where you're at right now. Very valuable tool in knowing what's going on inside your body, and it's super inexpensive to be able to check all that. So if you have any questions about this, just you can write me a comment or message me or whatever, and I'll be glad to help answer whatever I can. And if I don't know the answer, I'll ask somebody, or I'll send you a link to more information. Thanks. Have a great day.